Welcome everyone to the Apothecary Tales, the basics of pharmacology. Today we're going to talk about the drugs that is used in the treatment of two neurodegenerative diseases, that is the multiple sclerosis and an amyotrophic lateral sclerosis. So let's just get started. So first, what is multiple sclerosis? It is an autoimmune inflammatory demyelinating disease of the CNS. So what is this demyelination? That is the removal of the myelin sheath. So this myelin sheath is an insulating layer that forms around the nerves, including those in the brain and the spinal cord. It allows the electrical impulses to transmit quickly and efficiently along the nerve cells. So what is this multiple sclerosis? It is an inflammatory, demyelinating, neurodegenerative autoimmune disease of the central nervous system. And the exact immune mechanism is not completely understood. However, the Th1 cells and the inflammatory cytokines that they secrete are strongly implicated. The clinical features of multiple sclerosis include the sensory disturbance and motor dysfunction that can be highly variable and dependent on many factors, such as the size of the pathological lesions and the rate of new lesion formations. For some patients, the multiple sclerosis may consist of one or two acute neurologic episodes. For others, it is a chronic, relapsing or progressive disease that may span 10 to 20 years. And historically, corticosteroids, for instance, the dexamethasone and prednisone, have been used for the treatment of MS, that is helping in the acute exacerbation of the disease. Chemotherapeutic agents such as cyclophosphamide and azathioprine have also been used. Next, we're going to talk about the disease-modifying therapies in the treatment of multiple sclerosis. So the drugs that has been currently approved for the multiple sclerosis are indicated to decrease the relapse rates or in some cases to prevent the accumulation of the disability. And the major target of these medications is to modify the immune response through the inhibition of the WBC-mediated inflammatory processes that eventually lead to the myelin sheath damage and decreased or inappropriate axonal communication between the cells. So that is the main role of this disease-modifying therapies. So the examples include first the interferon beta 1A and interferon beta 1B. The immunomodulatory effects of these interferons help to diminish the inflammatory responses that lead to the demyelination of the axon sheaths. And the adverse effects associated with these medications include depression, local injection site reactions, hepatic enzyme increases, and flu-like symptoms. The next drug is the Glatiramer, which is a synthetic polypeptide that resembles the myelin protein and may act as a decoy to T-cell attack. Some patients may experience a post-injection reaction that may include flushing, chest pain, anxiety, and itching. And these are usually self-limiting. The next drug is the Fingolimod, which is an oral drug that alters the lymphocyte migration, which will further result in fewer lymphocytes in the CNS, thereby decreasing the inflammatory process. Fingolimod may cause first-dose bradycardia and is associated with an increased risk of infection and macular edema. The next drug is Teriflunomide, which is an oral pyrimidine synthesis inhibitor that leads to a lower concentration of active lymphocytes in the CNS. That means it is decreasing the amount of the lymphocytes for the inflammatory process in the CNS. The teriflunomide may cause elevated liver enzymes and should be also avoided in the pregnant women. The next drug is dimethyl fumarate, which is an oral agent that may alter the cellular response to oxidative stress, thereby reducing the disease progression. Flushing and abdominal pain are the most common adverse events. The next one is Natalizumab, which is a monoclonal antibody that has been indicated for the MS in patients who have failed for the first-line therapy. That means this drug is not used as a first-line agent. Instead, it is used for patients who have failed first-line therapies. Next is the Mitoxantrone, which is a cytotoxic anthracycline analog that will kill the T cells and may also be used for this So that is all about the disease-modifying therapies, which include the Interferon beta 1A and Interferon beta 1B, Glatiramer, Fingolimod, Teriflunomide, Dimethyl fumarate, Natalizumab, Mitoxantrone. Next, we are going to talk about the symptomatic treatment in the multiple sclerosis. The many different classes of drugs are used to manage the symptoms of the multiple sclerosis, such as the spasticity, constipation, bladder dysfunction and depression. One such drug is the dalfampiridine, that is an oral potassium channel blocker which improves the walking speeds in patients with MS. At the same time will increase the ambulation, fatigue and endurance. So what is the action of the potassium channel blockers? They are responsible for increasing the potassium currents in the demyelinated axons, which is a characteristic of the multiple sclerosis, and hence improve the nerve impulse propagation. And this drug is the first approved drug for this multiple sclerosis. So that is all about the multiple sclerosis. Next, we're going to talk about the amyotrophic lateral sclerosis. It is usually characterized by the progressive degeneration of motor neurons, which includes both the upper as well as lower motor neurons, and this is a very rare condition which will result in the inability to initiate or control muscle movements and ultimately result in muscle weakness, progressive motor disability and finally death by respiratory failure or an associated infection. Now what happens in this amyotrophic lateral sclerosis is that the degeneration and death of both the upper motor neurons and the lower motor neurons will lead to the retrograde axonal loss, which ultimately leads to the secondary myelin pallor as well as the gliosis. So what is gliosis? The non-specific reactive change of the glial cells that is in response to the damage to the CNS. So this will occur in the case of amyotrophic lateral sclerosis. The Riluzole, which is an NMDA receptor antagonist, is the currently only drug that has been indicated for the management of the amyotrophic lateral sclerosis. And it is believed to act by inhibiting the glutamate release and blocking the sodium channels and will further decrease the excitotoxicity and apoptosis. And this drug may improve the survival time, at the same time will delay the need for the ventilator support in patients suffering from the amyotrophic lateral sclerosis. So that is all about the multiple sclerosis and the lateral sclerosis. Now let's just summarize. In this video we have discussed about the multiple sclerosis, the clinical features and treatment strategies, as well as the amyotrophic lateral sclerosis. We have discussed its clinical features and treatment strategies. So if there's any doubt, comments and suggestions, please do mail on us. Thank you.